Now, one of the important things to bring out at this point is post-operative rehabilitation. Now, surgery, like I said, is relatively simple from a patient's perspective. A 2-hour procedure, you go home the next day, come back in 2 weeks' time, we remove all dressings, and you will be looking for where is the implant in the head, and the X-ray will show you it's all in place. But that is about it, and the patient will feel very, very happy and comfortable, and there's absolutely no problem that any of our patients complain about. 3 weeks after surgery, we switch on the device, and that is the day that hearing is back, is restored. That is the first day the child hears, in the case of children who are born with no hearing. So once the switch on is complete, we then have to slowly increase the frequency and the whole spectrum of sound that we make available to the child. We start with introducing only part of all the sounds available, but slowly a process called repeated mapping of the device, we increase ultimately to a point wherein the entire spectrum of sound is made available to hear. Now, apart from regular mapping, what is crucial to get a good outcome is post-operative rehabilitation. In scientific terms, it's called auditory verbal training. Auditory as in hearing and verbal as in speaking. So hearing and speaking that you and me may think is so natural and so easy does not come so spontaneously to a child who's grown to 3 or 4 years of age without having heard or spoken at all. Such a child, what happens is that even though he's hearing everything, he tends to ignore it, and he tends to go on in his regular life of signing and relying on actions. So you've got to sit this child down and in a very systematic way introduce to him all the sounds, the value of sound, the value of hearing, and promote and stimulate him into repeating all that he is hearing. This whole process of auditory verbal training is called post-operative rehabilitation, and it has been shown beyond doubt that rehabilitation is a must for every implanted child and adult. Now, an adult who has previously normal speech and language will not need rehabilitation for long, but in the case of children, they will need 1 to 1.5 years of systematic training and rehabilitation. If this is not done, the outcome from cochlear implantation is not going to be complete at all. And it is very important that you understand this. We take great pains to ensure that every patient that we operate on goes through a systematic process of rehabilitation. Only if we do that will we get a fantastic outcome. We know that our 3-year-old will join his peers in regular school, in a regular mainstream school, and will do as well as any other child. But that will only happen if after implantation his rehabilitation is completed. What typically happens is that our children start to do wonderfully well very soon. They start to hear all sounds, they're part of dining table conversations, mom says he can hear everything, and that sometimes puts them off rehabilitation because they think, oh, we're just doing fine. But the truth is that if rehabilitation is not completed, they will not achieve all that they can achieve.